Welcome everyone to this webinar regarding PAD, peripheral artery disease. To start this webinar, we will have Dr. Jean-Pascal Costa, who's going to present the guide in general and how we develop it at the foundation. And then we will have a presentation regarding diagnosis of PAD. To do so, we will have a conference by Dr. Samuel Deschamps.
So hi everyone, and very happy to be with you today for this webinar on peripheral artery disease that we also call PAD. My name is Jean-Pascal Costa. I'm an internal medicine specialist working at the CHUM Hospital in Montreal, and my role today is to present to you our wonderful guide. After this short presentation, I will let my colleague, Dr. Samuel Deschamps, who is going to talk to you about diagnosing PAD. So I'll start by giving you some information on our guide, and then Dr. Deschamps will go on by explaining the symptoms of PAD, and he will explain the diagnostic methods of PAD, and we'll have a short period of questions at the end. So before we go on, let me explain the reasons behind this guide. So first of all, we started with the following observation. PAD is an unknown disease by general population. If we compare to other diseases like heart attack, stroke, or breast cancer, PAD is not as advertised. We then identified the need to create information intended for patients and family, as well as for healthcare professionals that take care of these patients. We then consulted an instructional designer to help us with the content and the way to present that content. We also hired a graphic designer who created wonderful illustrations to highlight the content. The next step was to determine the table of content. And then we had to find some authors, specialists in their own fields. We then gave them a challenge. The challenge was for them to use plain language and write a text accessible for all. And I have to say that they were able to rise to the challenge. So here you can see the different themes tackled in the guide. So first of all, we start by giving a definition of the peripheral artery disease. And then we go on by explaining what's happening in your leg. We then give some risk factors related to PAD. And then we explain the diagnostic methods. There's also a chapter on how peripheral artery disease affects your daily life. And there's another chapter on the treatments. And we finish by giving some tools to help the patients and their family to deal with the disease. So here you can see the different authors of the guide. So people coming from different disciplines. For example, we have residents in general internal medicine. We have residents in radiology. We have psychologists. We also have vascular surgeons and residents in vascular surgery. And we also have kinesiotherapists. So the guide is a total of 20 collaborators, people from editors to reviewers. I have to acknowledge donations from Bayer, Canada, and from generous families and Canadian institutions that really helped to financing this project. I have to thank Mr. Gabriel Dumochel, our instructional designer, and Christine Saint-Onge, our graphic designer. Speaking of Christine Saint-Onge, here you can admire her amazing graphic work. So here you can see examples of pages of the guide. As you can see, once again, amazing illustrations by Christine Saint-Onge. And this brings me to introduce our good friend Tim. So Tim is our mascot, our friendly character who takes care of his health and who likes it when the information is short and simple. So this means that if you don't have time to read the entire guide, you just need to find Tim and he will give you a summary of what you need to know on each chapter of the guide. So allow me to join my good friend Tim, and together we wish you happy reading. Thank you very much.
Hello, everyone. Thank you, Dr. Costa. I would like to thank the foundation for letting me do this presentation today. As a radiology resident, I will talk to you about the diagnosis of peripheral arterial disease. First, let's talk about the symptoms of the PAD. In its milder form, PAD is silent and causes no symptoms. Therefore, it can only be detected by diagnostic tests. For many, the first symptom to appear is a painful muscle cramp in the leg while walking, resulting in what we call intermittent claudication. Rest is then the only intervention that can relieve the cramp. This leg pain can be severe enough to discourage a person from walking normally, so it can be pretty severe. Some people will not experience cramps or pain, but will feel numbness, weakness, or heaviness in the muscles. It is necessary for you to talk about these symptoms with your doctor, these symptoms that you perceive during physical activity, and don't consider them as part of normal aging. In patients with more severe PAD, insufficient blood flow to the feet and legs can cause a sharp burning pain in the feet and toes, even at rest. In fact, the pain occurs especially at night when laying down. Other symptoms to watch out for are cooling of the skin in specific areas of the legs or feet, skin color changes and hair loss, sores on toes and feet that do not heal. In fact, as much as 55% of patients with PAD are asymptomatic. These people are at high risk of having a heart attack or a stroke. Recently, studies have shown that life expectancy of people with PAD is drastically reduced. For example, the risk of dying from a heart disease is 6 times greater in people with PAD than those without. It is therefore very important to discuss this condition with a healthcare professional if the symptoms listed before or the risk factors cited by Dr. Costa are present. Physicians should be very vigilant and proactive. That brings us to the main subject of my presentation, the diagnosis of PAD. In general, screening for PAD is initiated by calculating the ankle brachial index, also called ABI. This simple, inexpensive, and non invasive test involves calculating the ratio of the highest blood pressure in each ankle to the highest arm pressure. So after a rest period of 15 to 30 minutes with the patient lying on his back, a pressure cuff and a Doppler probe are used to measure the blood pressure in the arms and ankles, uh, as shown on the figure. In some patients, especially those with diabetes or chronic kidney disease, the pressure in the leg may be too difficult to measure because of calcium deficits in the artery walls. In this case, we opt for measuring the pressure on the big toe. With this test, two results are obtained, watch one for each leg, which are generally proportional to the severity of the PAD. When the blood vessels are intact, the measures for the arm and legs are almost identical, making the ABI, which is a ratio, equivalent to 1. If the ABI is less than zero point 0.9, we highly suspect PAD. The lower is the ABI, the greater the circulatory disturbance, and further evaluations become indicated. Um, in patients with a high degree of suspicion of PAD and or with a lowered ABI, the next step is a Doppler ultrasound assessment of the legs. Also inexpensive and non-invasive. Um, this technique involves scanning an ultrasound probe over the skin, making it possible to visualize the blood vessels. The doctor will therefore be able to determine the precise location and severity of the occlusion. We can see on the image at the top in red, this is the blood vessels. This is the blood vessels. And on the lower part of the image, on the graphic, this graphic represents the speed of the blood in the arteries. Although this is a very good technique, Doppler has its limitations. It is suboptimal in obese patients and in those with artery walls calcified with calcium. It is also less accurate for evaluating blood vessels that are in the abdomen near the aorta. Um, Lastly, more in-depth exam exists in patient for whom echo Doppler exploration has been judged insufficient, or when planning a minimally invasive procedure or a surgery treatment. It becomes necessary to opt for imaging examination with injection of contrast through the veins. There are two possibilities. The first is computerized tomography angiography, also called CT angiogram, and the other is magnetic resonance imaging, MRI. In the case of CT angiogram, the patient is lying on an examination table, which is advanced into a tunnel. A contrast product called iodine is injected into a vein in the arm. Uh, the injection of contrast reveals the arteries when the images with X-ray is taken. A computer then performs three-dimensional reconstruction of the vessels, which allows their walls and lumen to be accurately assessed. We have an example here on the picture. This is a very good technique. It is very effective, but comes at high cost. For the MRI, the patient is lying in the tunnel where in some case he will receive an injection of contrast medium called gadolinium in a vein. Using a magnet generating electromagnetic field, MRI produces highly accurate cross-sectional images of the vessels without exposing the patient to any X-ray radiation. This examination is very precise, but expensive and not easily accessible. To conclude, it is very important to give your doctor enough information about your symptoms so he can classify the severity of PAD and prescribe the correct diagnosis, test, and treatment within an appropriate time frame. I invite you to consult the guide on PAD as well as the foundation's website for more information on PAD, and the name of certain organization that can provide you with additional information. Other videos produced by the foundation are available on YouTube. They cover peripheral artery disease, physical examination, physical activity, medication, and surgery for PAD. I invite you to watch them, and thank you for your attention. The angio-CT imaging technique uses X-rays to produce images. X-rays are indeed a form of ionized radiation. Very high doses or repetitive exposition can, in fact, induce cancer, but the radiation used for CT scan is very low and not harmful when used appropriately. However, it remains contraindicated for pregnant women. Magnetic resonance and Doppler um, do not use radiation to generate images. Commonly, the injection of an iodine agent can cause mild side effects, such as a warm sensation in the arm or throughout the body. It can also cause nausea or a metallic taste in the mouth. Rarely, some people will have a mild allergic reaction, such as itching, rash, or hives. Exceptionally, serious allergic reaction manifestation may be noted, such as throat edema or cardiac shock. Um, in preparation for the exam, it is recommended to eat a light meal before the exam. You must also report any allergy when making the appointment, and if necessary, an anti-allergic medication prescription will be given to you. If you have ever had a severe allergic reaction to a contrast agent, you're highly susceptible of having another one. So an alternate exam modality should be considered by a doctor, like ultrasound or MRI. If you have known kidney failure, diabetes, or if you're over 70, you will probably be given a prescription for a blood test before the exam.